Hi, I'm Joe Lindahl, Executive Director for the MSA Coalition, and I'm here to talk about advocacy. Earlier this year, the MSA Coalition Board of Directors began to have more consistent and invested conversations around the area of advocacy, specifically at the federal level. Access to social benefits, prescription costs, healthcare access and equity, research funding, all of these are issues the MSA Coalition should contribute our unique voice and expertise. We feel advocacy is such an important role for the coalition to play. We have made it one of our strategic priorities. As an area of focus, we have started to create an infrastructure and blueprint to enhance MSA awareness with elected officials and their staff to raise our profile at the national level. Recently, we've had the good fortune of joining the Unified Parkinson's Advisory Council, or UPAC, which is a coalition of Parkinson's and atypical Parkinsonisms, such as MSA, to work together to create meaningful legislative change that impacts our shared audiences. As part of the UPAC, we will be working hard to advocate and support the recently introduced National Plan to End Parkinson's Act, providing a multiple system atrophy specific voice to Congress. This legislation will create an advisory council comprised of representatives from federal agencies already working on Parkinson's, as well as representatives from the private sector in the community, people with Parkinson's, care partners, healthcare experts, and others. This advisory council will work together to create a strategic plan to end Parkinson's, and they will be responsible for reporting to Congress every year on their progress and impact. So you may be curious, how can you get involved with the MSA Coalition and help support our advocacy footprint? Here's a few things you can do right away. You can visit our new advocacy section on the website. We've created a new online tool that provides you with access to our key issues and the ability to easily advocate via email, social media, and even an easy phone call. We're working hard to support the National Plan to End Parkinson's Act and created scripts and templates to make it quick and easy for you. 2, share your stories. Members of Congress and your elected officials want to know what's most important to you and how to best represent our cause. We can educate them about what it is like to live with MSA or knowing or caring for someone with MSA so they can understand why it's so important to support the National Plan to End Parkinson's Act. The MSA Coalition will be providing some hands-on resources to help when meeting with your representatives in person or sharing your story with us for virtual impact. As the phrase goes, all politics is local. While we are focusing on federal legislation in the near term, we are fully aware of the impact of grassroots advocacy. As our strategic agenda evolves, there will be different opportunities to get involved with our advocacy initiatives. We will purposely offer volunteer roles that are from the advocacy novice to the professional lobbyist, from those who wish to write letters to those who would even fly to Capitol Hill and everything in between. Whether you wish to give 5 minutes to 10 hours, your participation is critical for the coalition's advocacy and awareness success. We have a sign-up link for those who are interested in volunteering in the future. Complete the quick form from our Action Center and we'll let you know how you can help.
Hello, I'm Patricia Libby Tevet. I'm a board member and chair of the Coalition's Advocacy Committee. My husband Joel had MSA, and I know firsthand the frustrations that come with battling a rare disease that is so little known. As we look ahead to 2023, we are setting some exciting advocacy goals that will not only raise much needed awareness about MSA, but will amplify the voices of our community in Congress and elsewhere. We want to make sure that legislators and policymakers understand the needs of MSA patients and their families and educate them that the coalition is the source of information about MSA that they can rely on in making informed decisions that will have a positive impact on the MSA community. One of our advocacy goals is to seek elimination of the 2-year Medicare waiting period for MSA patients who are not yet 65. As some of you may know, once a person qualifies for Social Security disability, they have to wait 2 years or until they turn 65 to become eligible for Medicare. We all know that 2 years is a very long time in the world of MSA. and medical costs and insurance are extremely expensive. This is just one example of the type of legislative action we want to take in the immediate future. We look forward to keeping you updated on our efforts and empowering each of you to join us in raising our voices in support of our community. Thank you.